Hi, this is Dr. Doreste with the cranial release technique with my lovely wife, Soledad. We wanted to say Happy New Year. It's December 31 here in sunny Florida. It's about 2:30 in the afternoon, and again, just wanted to wish everyone a wonderful, wonderful Happy New Year, a wonderful, healthy 2024 for you, your friends, your family, health, happiness, prosperity to everybody. And we were talking before, and I was remembering a story probably about 18 years ago, more or less, because the girl was an infant then.
She's 18
And
now.
she's 18 now. And little Melanie was brought to us. She was the granddaughter of one of my wife's best friends. And she was at the time a month or two old maybe, with terrible colic. The first baby for a young couple. And, just every night, every day, just screaming, screaming, screaming. They tried all the home remedies, whatever they did. And Grandma said to them, why don't you go and bring little Melanie to Dr. Doreste for cranial release. And so it was a very interesting story because, and I had worked on plenty of children with colic, and I was very confident of what was going to happen. So I took a look at the child. This is obviously the plastic model of the fetal skull, and I looked at the child, and I saw some distortion. One eye small, one eye low, ears rotated, entire skull rotated, like I see virtually on every child. And to the best of my memory, again, 18 years ago, it was a normal delivery. I don't recall any quote-unquote traumatic delivery. I don't think it was C-section, but I don't recall. I don't know if there were a vacuum extractor used. I don't recall all the details because I don't have any notes from 18 years ago. But the only reason why I want to tell the story, which was interesting, was when I applied the cranial release to the one side. I started on the left side like I always do. Then I did the right side of the cranium. The baby instantly calmed down. The parents were thrilled. We said goodbye. I said, I'll come back in a week or so. I don't remember. We'll check her again. And literally within 5 minutes after they left, I was bent over with the worst colic, intestinal gas. I don't know what we'll call it. I'll just call it colic because that's what the baby had. And I was literally holding my stomach and I couldn't straighten up. And I had this just terrible pain. And it was almost as if that the colic from the baby came into me. I don't know. I don't know how it happened. I don't have any explanation for it. I don't think it's ever happened before to me. And it's never happened again. And just very interesting. Very interesting. I have no idea what that was, but we applied the cranial release. The concept again was the same, to enhance the primary respiratory mechanism of little Melanie. Yep. And that was it. Somehow, some way, I don't know, I bent over. I lasted about 5 minutes. I was in terrible pain. And then it passed, it never came back, and the baby's colic never came back. So, I mean, maybe you've experienced that in whatever techniques that you do as a chiropractor, as a massage therapist, as a acupuncturist, whatever it is that you do, as a naturopath. But it was a very, very interesting phenomenon. And if any of you have experienced it, put the comments down below. I'd like to hear about it, but I have no idea what that was. It's not in the cranial release protocols to take on the patient's illness or to take on the patient's infirmity or sickness or whatever, but it happened with that little baby with me, and I've worked on a lot of babies and it's never happened before. So that's all I have to say about that. Any last words of wisdom?
Have a happy new year and
Happy
be a
New Year.
healthy one for everyone.
Healthy, happy for everyone. Algo en español.
Feliz año a la familia, los amigos y a todos los miembros del CRT. Gracias.
Perfecto. Thank you. Okay, goodbye everybody. Talk to you in the new year. Dr. Doreste, adios for 2023. We'll be back in touch in 2024. Hope to see you down the road. Adios, my friends. Ciao.